we are recording, we will let our reporters in.
One moment.
We are recording, we will let our reporters in. Can you mute your mic, Barb, because that was coming through.
All set.
All right. With that, we will admit all of our reporters, and we got a lot, so I think we'll have a lot of questions. So we'll start here in just a second. Just giving it a minute as people are logging on.
You have Mr. Castro in the waiting room as well.
All right, it looks like we have everyone here. I want to welcome everybody to this press conference. I am going to turn it over to you, Dr. Jenkins, for opening remarks.
Okay, thank you so much, Mr. Lamons, and good morning to everyone. I'd like to thank everyone for being here this morning. Members of the media, we really appreciate the fact that you're here today and that you continue to come out and help us, as we know it's very important to have this partnership where we share information in a timely fashion with our community, and we really do appreciate you as the media, and we know the importance of having a free press. I want to thank the UW Health experts who are on here today. This call, along with members of our Board of Education and members of the senior leadership team. We have with us also members from our teachers organization, MTI, our president, in fact, Mr. Jones, and then we have also one of our principal leaders here with us. So really it's just a collaborative effort as we are trying to respond to our decision to take a pause, okay? This is a significant situation for all of us, and we know the difficulties is extremely difficulty for our families when we make decisions like this. So we don't take this lightly. Please know that. And we've been working on this. We've been following along the science the entire time. And we're here today to give you an explanation as for how we are going to pause for a week so that we can get back in school and stay in school for the remainder of the year. We all know the impact of having been out the first time with virtual schools because of COVID-19, but we do know more now than what we did know when COVID first hit. So today you're going to hear a lot from not only myself, but other members of our team to tell you just how we plan to go back to school and stay in school. So now at this time, I would like to introduce our board chair, Ali Moultrie, at this time.
Thank you so much, Dr. Jenkins. This school year, we have been committed to strong safety and mitigation strategies in our schools and buildings. The board has taken steps to address critical staffing shortages, and our district has created opportunities for both staff and students to be vaccinated. Our community has witnessed our willingness and need to pivot when conditions change. Extending winter break for 3 days and returning to virtual learning for 2 days will strengthen our ability to return to schools in person on Monday, January 10th. We are navigating this pandemic in real time, and the recent surge of COVID cases in our community can't be ignored. The Board of Education will meet today at 12:30 to discuss the extension of winter break and hear from our medical experts in open session on Zoom. I want to ask our community to prioritize our schools. Please reconsider your New Year's Eve plans. Please get your booster, get your family vaccinated, and wear a high quality, medically informed mask when in social settings. Thank you to everyone who has supported us, our teachers, and our children throughout these unprecedented times. And with that, I will turn it over to Tim Lamons, who will be facilitating this press conference.
Thank you, Ali. Just quickly, I want to work through the ground rules for this press conference so that we can keep things moving and give everyone an opportunity to ask their questions. What we'll do is we're taking a roster of the reporters who are joining us today. We will call on you and we ask that you ask all of your questions at once. And once all of your questions are answered, we will move on to the next reporter. And then at the end, we will circle back and open up to the room for any follow-up questions after we work through everyone on the roster. So with that, we will begin our question and answer portion of this press conference. And we are going to start with Taj Mahal with NBC 15.
Awesome. Thanks for taking questions and for doing this press availability. We appreciate it. My first question is, was it reported that there were any positive cases among students or staff? And is that what prompted the decision to delay the start of school? Or is it just kind of the general increase in transmission that we're seeing in the community right now?
Yeah, that is a great question. And let me just say to you, first of all, it's always our preference to remain in learning in person for our learning. We take this very seriously, as we have all along. We've said we're following the science behind it, listening to the CDC recommendations, following our own public health, and then working with our metrics teams, with our medical advisors, and looking at a combination of factors. It's not just an easy thing to say it's on or off because of the positive counts. But yes, we know that we're looking at the total case counts. They've been doubling for us, alarming rate of over, like every 2 days, we're seeing this increase, just like the nation, right? And right here in Dane County. When we think about those things and trying to forecast what we're trying to do in preparation for the steep forecast of what we may see in terms of a spike, those were just some of the factors. Now, on top of that, we were also looking at where we are with our staffing abilities. As you know, it's a national shortage in terms of staffing at all levels. Even when you go to AutoZone, right? It's a shortage at the restaurants, but schools are not immune to that. We've been seeing that. And so we have even taken individuals out of subbing the traditional way of their positions and placing them in the buildings trying to sub. So those things were also factors. But when we look at MMSD case counts right now, what we're experiencing in Dane County, it was a number of factors, and our ability to be able to continue to test is another concern. There's like a national shortage right now in the ability to be able to get the number of tests that we need to be able to do it in a consistent way. And in MMSD, we're trying to make sure that we're doing all the mitigation that has been laid out by CDC, our public health, our medical advisors. So all those factors, I wish I could just give you one answer, but it's multiplicity.
Thank you for that, Dr. Jenkins. So what kind of metrics are we looking at in terms of being comfortable bringing the kids back in person? Is there anything specific that the board and district leaders are going to be looking to health officials to kind of learn to be comfortable making that decision to say, okay, we're going to have the kids back in school?
One of the main things here that we were looking at, like we said, we've been following the science of everything. You saw the latest recommendations from CDC and public health. And to a degree, let me just put this out there, as they're relaxing in our district, we're still trying to tighten. And if you look at us, we've been in school and haven't been having to shut down because of the mitigation strategies, the strong strategies we're putting in place. Trying to take the recommendations from CDC and public health, go to our metric meetings and look at how we're doubling the case counts now, or how can we, based on what we've already learned, how can we remain in schools consistently versus starting school back in the fall, anticipating a spike, and based on the number of individuals who are self-reporting at this point and other information we're gathering from our screening. We think that taking this time to pause will allow us to be able to get additional testing during this week for some of our students some of our staff who are showing various symptoms. And then we're very much hoping that also our staff going back reinforcing what we had to do with virtual learning on Thursday and Friday. It's for us, it's very aspirational that Monday, given that there is nothing catastrophic that takes place, because this thing is really day by day, we should be back moving and being consistently back in school for the remainder of the semester. That's what we are hoping at this point, based upon lessons learned and some of the guidance we're getting.
Okay, my last question is, what do you kind of say to those parents and families who have had a really rough last year? And I mean, even in 2020, when the pandemic first started, having to adjust to virtual learning and kind of the challenges that that creates for families and children. We've spoken to some parents that are kind of struggling with the idea that they might have to do that again. What's your message to families that are worried right now?
Well, a part of what has happened, lessons learned, we know wholeheartedly that virtual learning for a long periods of time is not going to be good for our students. What we face or what we realized is social emotional impact. Dr. Demary is on call with us as well. He can speak to that better than I can, but we are seeing long-term effects of just being virtual. Our intent this week, giving our staff 3 days to prepare. We're going to do the virtual on Thursday and Friday. Also coming back, everyone will give individuals opportunity to get tested. But our goal is on Monday and to be moving forward with our plan of continuing with the mitigation and just asking parents we know it's difficult and there's no way around that. It is difficult. If they can be patient with us, what we're trying to do is to get back to school, stay in school based on all of the lessons we have learned. As you look at our case counts, even though it has been rising, when you look at it on a national level, districts our size, we're outpacing the average. And we want to be there, but we want to be even better, make sure that our students are safe, our staff safe, and we're being responsible to our community. So parents, please, if you can just hang in there and, and just allow us to move us forward and try to keep our children in school. That's important, not only just directly even at our parents, but for our whole community.
Any other questions, Tajma?
Actually, I'm sorry, I do have one more question. I do know that there are some schools, nationwide, universities included, that have gone as far as saying, okay, we need a vaccine card and a negative COVID test for you to come back to school. Is that any sort of possibility? Is that something on the table being considered here?
Well, actually, I can tell you what we're doing right now. In fact, I'll have Dr. Esser, Nurse Carey, speak to that, what we're doing in terms of giving ourselves an opportunity once someone has tested positive. Well, I'll just have them speak to that.
Nurse Carey, I'll let you take this one, please.
Sure. So right now, we're going to continue our process of every day families and staff are sent a screener by email where we are asking them to report if they have any symptoms, if they are a close contact to somebody who tested positive, or if they themselves have tested positive. And then we are going to continue to call and contact all of the people that complete the screener and advise them on the next steps of testing and their need to either isolate or quarantine. As of right now, we are also planning to continue our vaccine promotion. We are not able to require vaccines for students. That has to come from a state level. So we are not able to require vaccines, but we are heavily encouraging them. We are going to continue with our vaccine clinics next week that we have planned. We have also offered added additional booster dose opportunities for our staff and our students next week as well.
And there will be some opportunities. We're going to have additional conversations about how we're strengthening our mitigation in terms of individuals who are participating in co-curricular activities and strongly recommending that they not only be tested, but also providing a test for themselves as we are trying to make sure that we hold down any spread.
Thank you for that. Just really quick, Carrie, what's your official title?
Sorry, I am acting interim of Director of Health Services.
Thank you.
All right, thank you, Tajma. The next up is Scott Gerard with the Cap Times, who's joining us by telephone. Scott.
Thank you very much, and thank you all for the time. My first question, Dr. Jenkins, you mentioned the plan is to have people return on Monday, January 10th, unless something catastrophic happens. Are there metrics you all are using? What is there a standard for what would guide a return versus a not returning in person at that point?
I think right now, reasonably, we're looking at it and we haven't just set the exact point. We would go to our metrics team and get the medical advisors. Dr. Demary is on the phone right now, but we would listen to the guidance of what CDC is saying, what the health department is saying, what our medical advisors give us in terms of that break point to where we have to pull back. As I said earlier, this is day to day in terms of as we all are looking at it, but we're trying to put measures in place so that we can remain in school. Dr. Demary, I don't know if you want to speak to that as well.
Sure, I can just say, we did find out important information last school year, that community activity was not predictive of transmission within a school. Certainly, there are more cases in children, but most of the time they're getting COVID from home. And kind of paradoxically, schools appear to be a safer place for kids to be than in the household where most transmission occurs. With that said, there are other factors that are really important as well, such as staff infections in staff members, staff quarantine, and staff safety. So that's the primary concern. We do track secondary cases in school. And so that is an index that we would look at. We don't have a set number where we would make a recommendation to go virtual, but it is a number where we would follow carefully.
Thank you both very much. Speaking of staff, the press release announcing the change mentioned critical staffing shortages. Can you share any data or I guess numbers on what those shortages look like and what that means for the challenges of staffing a school building?
Yeah, it's very challenging during these times. And we have our chief of HR too, who's on the phone, who could speak to this. But in our HR analysis, as we've been watching, as you know, like I said earlier, that there are local, state, and national challenges with staffing. And we're just seeing a decrease each month with our ability to staff. Right before break, we were nearly at like a breaking point. But in terms of some of those numbers, in terms of the fill rates, I'll have Ms. Caradine speak to that in terms of even going back to October, and you can see the trend. And then with the increased calls of staffing may be out, that's a part of it, as well as we're trying to make sure that we have just great learning environments for our students. You can't do it if you don't have healthy staff as well. So Ms. Caradine, we want to speak to those numbers.
Good morning. That's a good question. So let me just say, starting out, it's been a steady decline. So like for October, we started our analysis with, if you think about it, you look at 20 instructional days, we had a 49.8% unfilled rate. November, we had about 19 instructional days, and we had a unfilled rate of about 47%. And we're looking at positions of absences. Say for November, we had absences of 4,965, and we were only able to fill half of those, which is like 2,600. December, we had only 12 instructional days. And so we had absences that needed subs of 3,131, and we were only able to fill 1,700 of those. So that unfill rate was 43%. Looking at, if you were to look at this week coming up, we have about, and this is from yesterday. So we have about 123 absences, and we have about 39% that are unfilled right now, but those absences are going up steadily as people are coming back from vacation, as people are starting to put them in. So these are just the absences that are in our absence management system. Okay. Did I answer your question fully?
That was extremely helpful. I greatly appreciate the detail there. I guess one follow-up question would be, given, the press release mentioned this, but with the peak of the Omicron wave expected to happen in mid to late January, how do you anticipate solving those staff shortages later in the month if things do return on January 10th?
That's also, oh, go ahead.
No, go ahead, please.
Oh, I was going to say, first of all, that's a good question. I want to say it's an ongoing issue. It will continue to be. I want to give shout out to our central office staff who have been subbing for us. That's one way that we've done it. Our chiefs and our administrators, and then also to the HR staff, where we're kind of looking at shifting around what we can do for that issue. I think we're trying to do workarounds. We're getting everybody all hands on deck for that.
Yep. And I'll just add, yeah, and if I may, Ms. Caradine, I'll just add here too, Scott, that is a great question, but as a part of our polls, we're looking at how we do this school by school as well to help with district resources, so we don't have to shut the district down again. This is what we mean when we say we want the pause to open back up in a way that's going to be sustainable. We're looking at the number of vacancies at each school, and we may have to do some shifting to be able to keep our district rolling, even if we have extraordinary case counts in a particular school. So moving forward, we're just trying to be as strategic and as we can to ensure that we can still be in school safely. But some of the things we can't do that we used to be able to do, we used to double up classrooms. And that was kind of a simple solution, right? Well, with the spread rate and the proximity, you just can't double up a classroom. You just can't increase the study halls. You can't, there are so many things with COVID. It used to be one reaction. For every situation now, there are like 5 other things you have to think through getting to it. Dr. DeMuro, you just came on. You have any thoughts on that?
Yeah, I just wanted to add on that it is key that safe return for students and for staff is key, dependent on our mitigation strategies. And in MMSD, that includes masking, that includes distancing, that includes a testing program. All these things play into the safe return.
Thank you all very much. What would you say to parents who are sort of scrambling now to figure out next week and early next week with no school about the timing of this announcement on the eve of a holiday weekend versus earlier in the week?
Yeah, it was, it's almost like a double-edged sword, right? We would have loved to have made it earlier, but we are taking into account everything that we're following in terms of the science, as we said. And when that peak hit, it was just at an inopportune time. And to wait till Monday wouldn't have been good. I don't know if there could have been a perfect time. And I just say to the parents, I'm apologetic that it had to be now, but at the same time, I'd rather to do and make a recommendation that's going to ensure the safety of everyone at this time. And we're working diligently with our MSCR. Ms. Dyer is on here. She's going to be working with our providers. And at this point, our providers, other providers, are just hearing this news. And so we're trying to set up meetings to meet with them as well so we can help provide the care. And we know that during the last virtual setting, it was very difficult. And so we are trying to look at that with MSCR to make sure that we can provide support for our parents and for our staff who also are facing some of those same issues. And I don't know if Ms. Dyer, if you had anything to add there.
I don't know that I have anything to add other than we will be, spending the time next week to prepare for childcare for those families that need it the most. If that has to be the case after the end of next week.
Right. And we're talking about 2 days this week. Scott, but even the planning that we're doing next week, we don't know what's going to happen down the road. But that planning would already be done. The last time we were all caught in a crisis and just really scrambling. But I thank you, Ms. Dyer, and her work and having been through it. Right now on our team, we've all been through this. And so we're just trying to think ahead versus reacting, but no one knows day to day how the virus is going to move. The Omicron came, and I'll be honest with you, the transmittal of it's moving much faster than it looked like COVID did. And so we're just trying to be ahead of it.
Thank you both. I think my final question is there any impact on having volunteers returning in person this new year because of this?
You asked a great question there. One of the things that we're trying to do, not only just for our staff, but we know the value of having our community, having our volunteers back in our buildings, but our protocols that we're putting in place and the mitigation strategies we're trying to look at, we were already looking at in our metrics team. How do we start getting our volunteers? And we appreciate the fact that they've been there virtually, but how do we put the mitigation strategies in place in a very safe way with our partners right now, be it the vendors or whatever, we have laid out those mitigation strategies. If we, as we continue to work together, I believe we're going to get to a point where we can see our volunteers being able to support our schools more than what we have in the past.
All right, thank you all.
Thank you, Scott. Next up is Robert with Madison 365.
Good morning. Thank you. First of all, just a context question from Ms. Carradine. You mentioned a few percentages of unfilled, substitute requirements. But how does that compare to a normal day or a normal week? 47, 48% sounds bad, but how much higher than normal is that?
Good question. So I will say it like this. Let me put it to you this way. So from October to November, you went from, it depends on the number. So the fill rate, the unfilled rate actually went up. So each month the fill rate went up, but it's also dependent on instructional days as well.
Uh-huh.
Okay. Is that what you're asking? Because the fill rate, so October, we had 20 instructional days. November, we had 19. December, we had 12. But each month, it went up steadily. And then for the last month, instructional days, we had 1,364 that were unfilled. So that's about half. And then as COVID cases came up, our unfilled rate went up as well.
Yeah, look back to 2019, like say, what would in a normal year pre-pandemic, what would you expect your unfilled substitute rate to be?
2019?
Yeah, so what I'm trying to get at is, 47% sounds bad, or half, it sounds bad that half your substitution needs are not filled, but how much worse than normal is that?
Well, 2019 is pre-pandemic, so usually it was not this high. It usually is not this high. And then in 2019, I think also too, they had, there were sub availability. There's more subs, there's more, it depends on what it was, teachers versus support staff as well.
Right, okay.
Okay.
Yeah, hey, look, if I may, Robert, also in that, and just like even pre-pandemic versus now during the pandemic, the social emotional well-being of staff who don't get their planning time or SEAs, people are having to do a whole lot more is very draining. Even if the numbers were the same, it's not the same, the impact. And that's what we're having to continuously look at and making sure that people are not burned out or just, are not there physically, mentally,
Got it. Thank you. I see Michael Jones is on the call. I wonder if I could ask you, Mr. Jones, how involved was MTI in this decision, and what does MTI have a position on the decision to do this pause for the week?
Hi. So we've been in consistent communications with Dr. Jenkins and MMSD leadership we've been part of the same metrics team that meets every Tuesday and having these ongoing conversations. I think we've been, earlier this week, we submitted a long list of questions that our members were positing to us that we communicated to district leadership in regards to the return. In terms of a stance, I think it's easy to look at this in political terms, in terms of saying, well, the union thinks this way or the district thinks this way, but we look at it as what is the science telling us? And when the science is telling us that, rates of COVID infections have gone up from like 6% to 46% amongst children aged 12 to 17, where they're telling us that COVID infection rates have gone from 5% to 25%. I'm talking from September 1st, the start of school to now. And we have our membership, our membership are human beings who have children and worry about bringing the Omicron variant back to their kids, or currently might have it and have to quarantine. Those are the things that factored into our understanding of, going along with this plan or not. We still have quite a few questions. We still have quite a few things that still need to be addressed, such as like childcare coverage for our members and for all employees as they're working the next week to get ready for our kids together. And also, how is this going to look? We had staffing issues long before this. Kind of piggybacking off of what Tracy and Dr. Jenkins said, this has been the last couple years have been an extremely traumatic time for anyone in our education system, but especially our staff, in terms of having to try to triage trauma that our kids are bringing in, and then also dealing with the trauma of trying to just kind of get through the day. So I think there's a lot of factors that kind of went into our collective decision to work together. I think there are definitely some things that we need to still push on, such as making sure that the days that our employees have lost because of COVID, because of quarantining and following the mitigation strategies, which were taking out sick days, and now people are on the verge of losing money out of their paycheck, or just having their whole sick days wiped out. And we're talking, heading into, we're not even halfway through what's a typical flu season or the COVID season. So, really addressing that, making sure people are being, that harm is being repaired. And we're really going to be pushing the district hard on that. But I think the thing is, just because you agree or disagree doesn't mean that you're not collaborating. So, we have been involved, and we'll just keep on pushing to get more involved in the future.
So given all that, do you think that is it MTI's position or your position that a week pause, 2 days virtual learning with the aspiration, understanding that it's fluid, but the aspiration to restart again next week, Monday the 10th, is that adequate, or would you rather see a longer pause or a longer period of virtual learning?
Our aspiration is to follow the science and to say and look at the numbers and see if the numbers are stabilizing. And then also look at kind of where, I want to make sure that I'm responsible to my membership in terms of what they need in their buildings, in communicating that to administrators before we make a stronger stance one way or the other on it, in terms of, what I will say is that we're not going to go by wishful thinking and sticking our heads in the sand when the science and the news around us is saying that people, when you have long lines wrapped around pharmacies saying no one can get tested, and then rates are skyrocketing amongst all age levels, and the damage that has gone, and people are still kind of getting together for Christmas and New Year's Eve parties and whatnot. Like the larger discussion can't just be around the schools, it has to be around what we're doing all as a community to get this thing under control. What are we doing at the county level? What are we doing at the city level to make sure that we are able to get back? I think our goal always is to get back into in-person, because it is so emotionally damaging to do this virtually, but it's also emotionally damaging to lose a child to COVID. It's also emotionally damaging to see a colleague lose 26 of their family members and relatives. If anyone read Carol Schumacher's story in the Wisconsin State Journal a couple of weeks back, that's real emotional damage, and we take that seriously. And that's not something that can be trifled away or pretended or looked the other way, just to provide cold comfort for a select group of people.
Thank you, Michael. Dr. Jenkins, the press release yesterday afternoon said that there would be an update on Thursday the 6th. Is that the idea that by Thursday or so we will have a decision as to whether we're going to meet the aspiration to return to in person on Monday? Or is that the plan?
Yeah, that's our intent. I'm sorry. Go ahead and finish.
No, that was it.
Yeah, that's our intent. We are having our metrics meeting where we meet as a team along with our medical advisors on Tuesday. The information from the health department will come out Thursday morning, and we're going to look at it, and then we will put another communication out in terms of where we are. But as we said, let me just be real clear.
Yeah,
it's not like the Omicron, this virus is going to go away from, if you're looking at most things following the science, tomorrow. So what we're trying to do is best position ourselves with the mitigation strategies Dr. DeMurray just mentioned, and this time here also giving us an opportunity to order more masks, do all the things that we need to do to ensure that we follow the science, which talks about the spread is more in the community than in the schools, and what people do outside of schools is another thing. But in the schools, we know that our students are safer than they are at home. So our goal, yes, is to get back and make an announcement Thursday based upon where we are. But something catastrophically could happen, right?
Yeah.
And if it does, I can't control the virus. I can't control if the governor steps in, all those things we can't, but we want to be responsible.
And then last question for me, and then I really appreciate the time. Last night, the announcement that you're going virtual, it was open-ended, and it felt reading the press release several times, it felt like it was for the foreseeable future, we're going to be virtual for an indefinite period of time. If the intent always was just a 1-week pause, why not communicate that more clearly?
Yeah, that's definitely on me in terms of we were just getting more information minute by minute, day by day. And I don't want to, it's aspirational. And aspirational, we want to be back to school on the 10th. But I said, if something, as I've said, if something catastrophically happened, I don't want to give you a false promise. And I don't have enough information. I'll wait to the metrics meeting, and then I can come out, and we like to just have more accurate information than just hope for, even in Michael's word, wishful thinking. What is it based on? So when we give a communication on Thursday, we're going to be able to say specifically, based on these set of criteria, this is why we're going to make a decision.
All right, that's all I got. Thank you, guys.
Thank you, Rob. Next up is Megan Hedstrom with Spectrum News.
Hi, you answered a lot of my questions, so just one real quick question. Did all the kids go home with all the technology and things that they need to be able to go right away virtually back to school after winter break?
Megan, you have been inside of our cabinet level meetings and in speaking with parents, and we know, and speaking with staff, not all of the children went home with their devices. So this allows us time to make sure that everyone has a device for Thursday and Friday. That's the issue behind that. It's not an issue, but it's just something we also know from past experience. When we had to shut down, that didn't happen. So we were trying to allow time for that as well.
Thank you.
Thank you. Next is Logan with News 3.
Thanks for having this, everybody. My questions have already been asked, so I'm good to go. Appreciate it.
Thank you.
We appreciate you too, Logan. Next is Emily Hammer with the Wisconsin State Journal.
Hi, thanks so much for doing this today, you guys. So I'm still a little confused about the timeline. So on January 6th, when you guys are making that decision, if case counts are the same as they are now, the community transmission has not gone down, does that mean you're going to extend this? Like, what has to happen on January 6th when you have that meeting to return to in-person on January 10th?
As I just stated, Emily, that's a good question. But to clarify, I was just stating that we're going to look at a number of factors come Thursday based on our metrics meeting we're going to have, based on the information that's released from our health department as well, and still knowing and understanding what's CDC. But we will make that decision at that point. Our aspiration is to return January the 10th. Let's be clear. We're pausing so that we can get back in school and stay in school. What we did learn from COVID-19, schools that closed and opened back up and they weren't really ready with their student, staff, or families, they had to close again. They opened. And as I talked to my colleagues across the country, that was like one of the top things that drew a lot of agitation in the communities about opening, closing, opening, closing. We have learned a lot from COVID-19 about what we can do now, and we think we're better prepared. Nothing will be perfect, but as we pivot, once we get the appropriate information and using the advice, the advisement from our medical team, that's what we're basing this on right now. And so Thursday, we will be very clear about why we also returning.
Can you be more specific, though, about the metrics that you're going to be considering? Like, is there a certain level that cases need to be at in order for you to go back on Monday, January 10th?
Well, it's multi-layered because it's not just the case count in general, unless it goes catastrophic. And this is what we have learned, that we can be in schools. There have been different studies that's been done, and Dr. DeMary can talk about that. That talks about the spread in the community versus the spread in the schools. And I mentioned earlier in terms of where we are in terms of districts our size, being, really above that average in terms of where we are. So we're going to have to look at case counts, but do we have all the mitigation? You heard us talking about the testing, the ability to test, the masking that came out from CDC, moving from the N95 mask to the surgical mask. What do we have within our grasp to make those moves? So that it's more than just a one answer thing to this. It's not just case counts alone.
Okay. I just am trying to gauge how optimistic or whether or not January 10th is realistic or not, because a week doesn't sound like too much more time in order to get all of that stuff in line, especially with cases being as high as they are now and kind of expected to continue to go up. And I don't see what is going to be much different given a week.
Well, we think from our end, we know the planning, the testing we're going to be able to do even this week with the people who are demonstrating that they're somewhat symptomatic at our clinics. I don't know if you know, we have clinics on sites in a number of our schools. And as we continue to move those clinics up, we'll be able to do more assessment as we get the test in to be able to do that. It gives us time to address our staff in a way. The whole social-emotional well-being of our staff is important to the well-being, social-emotional well-being of our students. And so we're collaborating on this and trying to put forth the best plan. And I think for right now, where we are is where we are, and we make the decision. But coming Thursday, we'll have even more information for you. It's not just on case counts. I'm going to say that to you again. And also where we are, we know we're expecting a spike, but right now, staffing levels is just a part of it. But as we're moving forward, we're very optimistic about January the 10th. Can't give you any outright just definite on that because we don't control the virus, like I said.
Do you have data on how many students are vaccinated right now?
Let me have Dr. DeMurray speak to you about the last point, and then we could come back to the percentages of students. Or are you talking about students all the way up to 18, or you talking about students 11 and younger? But you can answer that after Dr. DeMurray finishes.
Yeah, I just wanted to say on the case count thing, we know from Alpha variant, the first one, and then again from Delta, that attending school could be done safely with appropriate mitigation strategies, masking, social distancing, physical distancing, and then implementing strategies of vaccination. So I don't expect this spike to be any different. Again, things that influence whether or not a school can be open or not are less likely to be related to case counts in students as they are to things like staffing and other issues.
What public health experts did you guys consult in making this decision?
As a part of our advisory, and Dr. Esser, if you want to speak to the number of people, I thanked them at the beginning of it with UW Health, and we're following CDC, we're following public health, we're following all of that. If you want to speak to that part.
Yeah, thank you. We in the district, we are always looking to the CDC, the Wisconsin Department of Health and Public Health, Madison-Dane County, for recommendations and expectations related to COVID-19. In addition, we have assembled our own team of experts, and we meet with them weekly. On this call, I can introduce you to Dr. Greg DeMary, Dr. Ellen Wald, and Dr. Tom Friedrich, 3 members of our advisory group. As Dr. DeMary spoke about just a moment ago, part of our decision is related to, as we think about this, we're thinking about the number of positive cases, et cetera. So there's advisement that we're getting around COVID and what to expect moving forward from those groups. And then we have to make decisions based on that guidance from them. I should also add that we are a part of the ABC collaborative. And I maybe will ask Dr. DeMary just to come off to just give us a quick synopsis of the ABC collaborative, because this is an excellent organization that provides science behind school health.
So the ABC Science Collaborative is a group of physicians and researchers, scientists throughout the country interested in safe return of students during the COVID pandemic. And they are providing kind of the cutting edge research that a lot of our decisions are based on. There's a lot of going back and forth and sharing ideas and strategies. And this includes school districts from throughout the country, as large as the LA Unified School District and as small as some of the rural Wisconsin districts as well.
And while we're on that as well, I would like to have Dr. Friedrich and Dr. Wall, in terms of they've been on our metric team as a part of our advisement team as well. So Dr. Friedrich, if you could speak to it, and then Dr. Wall as well.
Sure, I can just say a few quick words. So not much to add substantively beyond what Dr. DeMary has said. So I think that the key thing that we need to keep in mind here is that school can be a safer place than a lot of other places that our students are going to be. And there's a lot of epidemiological data from earlier in the pandemic suggesting that even when case counts are high in the surrounding community, they can be relatively low in school. And I think that's because, in school we have, sort of a strong culture that promotes adherence. That means like being able to keep up with risk mitigation strategies, including masking and social distancing. So it's those policies that we have in place that that can reduce and help prevent transmission in schools, even when transmission in the community is high. And so this is sort of why we say that there's really no kind of magic number of case counts, which we've talked about in these weekly meetings that you've heard about on a regular basis. Is there a threshold above which we would say that this is the time to have schools go virtual? And the data as it's come in over the course of the pandemic suggests that there's really no kind of number that by itself will predict when schools should consider going virtual. So we have to consider multiple pieces of evidence in a gestalt, which as Dr. DeMary and I think Dr. Jenkins have also said, staffing levels are key. How many people are out because they're actively sick, that's probably going to be a more important number that's harder to predict from just the raw case counts in the community. Is that helpful?
Yeah, no doubt. Thank you. If you have any follow-up question for me, because Dr. Wall too, I would like to speak to it.
Yeah, I don't have much to add except really to repeat the very important message that regardless of what's going on in the community, the school can be a much safer place than the community because of the implementation of those mitigation strategies. And that MMSD has really been in the forefront for this whole season since school began in September in implementing those mitigation strategies and being true to them and being diligent in their oversight. And that is really the key issue. And as Dr. Demuri mentioned, our participation in that ABC Science Collaborative allows us to know that we are really the most up to date that we can be with regard to experiences that other schools are having. And so that really gives us a lot of confidence in what we're doing and continuing to do.
Thank you to all of the doctors too, and I really appreciate the information that you bring in each week and the research that they bring to the table and explaining to all of us and helping us make our decisions. So as you can see, we're not doing it in isolation. We have truly some of the best in the world advising us on this.
Dr. Jenkins, I had a question for you. So if schools appear to be a safer place for kids than within the household or out in the community, and there can be a lot of community spread, and schools still seem to be a safe place for kids, a lot of parents are frustrated right now I'm sure with this going to online even for a little bit. So why go online when schools are a safer place for kids?
Yeah, Emily, that's a great question. One of the things, like we said, we've learned, and I hope everybody realized we came back to school fully in the midst of a dual pandemics. We're looking at what's happening right now from the health side and the social justice side. We have to take into account of what we've learned even from the beginning of the year. We've seen an increased cases of students who having social emotional adjustments, staff having social emotional, parents having social emotional adjustments. Right before break across the country, you're seeing these different situations. We're trying to be best prepared, not only with just the health side of it, but also how we better prepare and give our staff an opportunity to debrief even from the fall as they're preparing for if something else happens to where we have to continue to go in this direction. The last time COVID hit, we did a crisis plan in about a day. Everybody did it, and we went into what I call crisis learning, not true virtual learning. But we want to make sure now that we know more information, we actually believe with the mitigation strategies that's been mentioned many times here, if we come back, regroup right now, we have a number of new staff that's going to be coming on January 3rd, and we all calibrate, we can be better prepared, not only just to go back to school, but to stay in school, given that all of those factors are adding up for us. So that's why we did it right now. And we just really based it upon how the science is leading us, and also how we're paying attention to the social emotional well-being of our students and our staff.
Has anyone been hospitalized or died after catching COVID during in-person learning in a Madison school district school?
Not to my knowledge, we don't have anyone who has died at this point. No, and we don't want that. Now, we've had a student, as you probably remember, that passed. That was prior to us being back in person, but no.
Okay. And what about hospitalizations? Do you know?
And I would have Dr. Esser, Nurse Carrie, to speak to that.
Okay.
Carrie, I'll let you so that we're careful with confidentiality.
Yes.
Sure. We have had some students that have been hospitalized due to COVID-19. We do not have an accurate count or number on that, but the number is low.
And is that from getting COVID-19 during in-person learning, or is it that it's just a student who could have gotten it anywhere, who was hospitalized?
Yeah, that is really hard to tell. I mean, we still struggle even with every positive case because we only contact trace in our school building. We are not in the business of asking our staff and our families what they're doing on the nights and weekends. So when we complete our contact tracing, we are only looking at what's happening in our transportation to and from school and in our school building. So it really is hard to determine where a source might have come for our staff and students.
I was wondering about, so returning to virtual learning, some of the students who are hardest hit by that are from low income families and families of color. What do you have to say to those families who are in those groups who have been hardest hit by moving to virtual?
Yeah, that's also a great question. I'm glad that you also brought up some of our families who are most vulnerable during this time, because during this whole COVID, we are trying to make sure that we're being very intentional about our families who have been most challenged. And yes, we know that these 2 days now that we've been back, our students are still in a pattern, and some are doing some mix with some online or doing their projects. And that's giving us this preparation time for how we can approach this too in a better manner than what we have been doing with virtual. So yeah, we have some students that we know that we're gonna have to be very intentional about, in other words, with this. But thank you for bringing that out about those families who have been most challenged, because we do know that that's the reality of ours. And with our focus on our strategic plan goal 3, that Black children and youth will excel, we know that there have been some since the beginning of COVID that hasn't necessarily been reached the way we want to reach them. But we're only talking about 2 days here, okay? And even though all time matters, that's another reason we're very motivated to get back in person, because we know we are better off. Dr. DeMary had his hand up for response.
I wanted to just add on to Emily's question about hospitalizations. Dr. Wald and I attend at American Family Children's Hospital, and we have seen many, many children with COVID and its complications. And I will say the majority have been from outside of Dane County, since we have a multi-state catchment area. But there are 2 elements in common with nearly all of these cases. The first is nearly all are unimmunized, and that's probably the key thing. And the second thing is nearly all have exposure in their household or family environment.
Thank you, Dr. DeMaria. We only have, we're at time, and I want to give Channel 27 News an opportunity to ask a question. I'll bring in Emily Ness. Emily?
Hi, everyone. Thank you so much for holding this and for answering all of our questions. This could be for anyone, but any words of encouragement for the students themselves during this time?
Yeah, I definitely, Emily, that is such a great question. And all of us, one of the things that we know, even though these are challenging times, we do feel more hopeful. We know more now than what we did know. Our job is to continue to ensure the safety of our students and of our staff, and being responsible in our community. As no one brought up co-curricular, but as I would like for you to know that we're continuing to push with co-curricular activities and having it as such, where students are doing the mitigations but staying involved. We've seen a tremendous impact that our students are just close to one another. This is, at this particular point, we're just making the best decision so that we can keep our students involved in school all year long. We know the impact of being in isolation. So thank you so much for that question. And I think, is that Dr. DeMary? Someone else have their hand up? I see a hand on my screen, Dr. DeMary, your hand was up. Sorry.
Left up from before, sorry.
Okay, definitely.
Thank you. So we have worked through the roster of reporters, and we are at time. And I want to thank everyone for joining us. Dr. Jenkins, closing comments.
Yes, I would just like to say again, I thank everyone from the media, everyone on our team being here today, gave us a real opportunity in real time to be able to speak to our community about where we are and why we're here. And also, I hope that you can find some true inspiration of the fact that we want to be back in school. We want to be back in school full time and don't have to close again. We know the impact. I'll never forget the graduating class of 2020 and what they went through. We want to make sure that this particular seniors, they end out very strong. We want to make sure our earliest learners have the best opportunity. We're very concerned, too much screen time. So this is why we're working to get ourselves in a position to help our students and help our families, because we know that this COVID has had a serious impact, but we're at a point right now, if we lean forward together, as we lean forward together, we know that we can come out with a better day for tomorrow.
All right, that concludes the press conference. Thank you, everyone, for joining us.
Thank you.